Occupational back pain treatment. The natural history of patients suffering from the episode of the back pain is actually quite positive. In the majority of the patients, symptoms will resolve without any treatment period. Physical therapy is one of the most commonly initiated rehabilitation programs for patients with low back pain. So the goal of the various exercises regimens is to promote strengthening of the key postural muscles. And when we have the vertebral column and the muscles around would be strong, they would cushion the vertebrae, they would stabilize them, they would keep them in an optimal position, hence the stress would be equally loaded, and the vertebrae would be not diminished by the excessive stress, excessive local stress. So, there are a lot of possible programs of physical therapy that will help in the back pain. One of those programs are the Mackenzie exercises, which are extension-based exercises that are believed to reduce discogenic pain by elevating pressure on the posterior annulus. Flexion-based regimens also exist and focus on decreasing compressive forces across the fascial joint in an effort to decrease compressive loads in the posterior aspect of the disc. So, obviously, when we flex, we put more of the stress on the anterior part, yes? When we extend, we put more of the stress on the posterior parts. Yes, of course I exaggerate, but you have the idea. Generally, there was a study that compared both methods and there was no significant difference between the two groups, except that sagittal mobility improved faster with the flexion exercises. So the sagittal mobility is to the sides, generally. The fitness programs, including Pilates and yoga, are additional options, targeting core strengthening for patients who are able to participate in them. The muscular conditioning afforded by these types of programs helps in maintaining the appropriate posture and reducing low back strain. So, one more time, we need to get the muscle strong enough to support the vertebral column to keep it stable. Regardless of the specific type of rehabilitation program implemented, a key component for long-term success is patient education regarding appropriate biomechanics for proper lifting and bending techniques in order to avoid further injury and pain. So, for many patients, back pain is everyday companion, yes? They can persist, they can last for very long. Physical therapy, when connected to other types of therapy, can really extremely help the patients. But also it would be the best if it would be just one thing given to the patient. So there needs to be some psychological, sometimes some pharmacological treatment, behavioral, and things like that. Okay, thank you very much.